So, Leanne, how was your week?
Hi, no, it's been really good, thanks, Flo. It's the start of the school summer holidays up in Scotland, so it's been
Right.
a bit of time with my boys, which is always lovely. We were down at the beach having lobster and chips earlier, so there's actually been some sun for the first time this year, it feels like. so that's been really good. Been a lovely week.
Oh,
What about you?
amazing.
What about you, Ali? Has your week been good?
Yes, thank you. Good week, but busy week. So yesterday was the Southwest Dentistry show, and yeah, so I was giving a talk on a full arch workflow that we've developed, and thanks to the lab we work with, Darren Kelsey's lab, and Ostom, who have come out with a new photogrammetry device, the Tupol 3D, for sponsoring it. So that was cool. But the really exciting bit is we had a lab tech start with us this week. So we're starting a digital lab in-house, and Jin is the tech. She's amazing. And her first job is to build the lab. So, but it was really cool because she was in the room with me for a few placements, and even we just had a couple of cases where we were putting in a couple of implants, but just having a lab tech in there was incredible. So yeah, really, really good week. Yeah, how was your week?
I had a good week. I've been in the Beacons celebrating a friend's 30th. So we did the classic four waterfalls walk and
Nice.
played some board games and ate some good food. So it was very nice.
Leanne, if you come visit, we'll take you there.
Yeah, do I have to do a big walk?
I'm saying this. I've lived here for 18 years. I've never been. So
We'll definitely have to do it then, definitely. So.
It is one of the classic people come from out of town and you take them on this walk and you get to stand under a waterfall. It's
can
very
you take
nice.
me first?
Okay, yeah. We'll do a practice trip. But
Check it, Steve.
So we're doing a special series of episodes covering sort of women in dentistry, highlighting some sort of incredible, inspiring women who are pushing the boundaries in the dental field. And this week we are joined by Dr. Leanne Branton, who is not only a seasoned GDP, but also leading the way in implant dentistry. She holds a prestigious diploma in implant dentistry from the Royal College of Surgeons and has over a decade of experience. She is also generous with her knowledge and shares her sort of oodles of wisdom with other clinicians through lectures and running courses at her academy to help ignite a fervent passion for implants. She is at the forefront of harnessing the power of cutting-edge digital technology and strives for excellence in every smile transformation. And we are delighted to welcome her to the podcast today. So
Having me.
how did you start your sort of implant journey?
Well, I've graduated, 21 years ago now, and to be honest, I just wanted to get out and start working. I, went straight into general practice. I kept on or stayed on in my VT practice as an associate, and I loved it. I just loved being in the hustle and bustle of a really busy practice. And my journey into implants actually came sort of later on. I bought my practice first. So I decided 4 years out of uni to set up a squat practice, which was probably not that well thought out, but looking back was of major benefit, because I think you can doubt yourself or question yourself so many times and delay it and delay it. So that came first, and we set up Southside Dental. And then I decided, somebody has to place implants in this place. And so went on a course. And those that have heard me speak before know that I left that course, and it's no disrespect to the course at all, very underprepared to go back out into practice. And this is over 15 years ago now. The mentoring support just wasn't there. It just didn't exist, the network that we have nowadays. And so I went out into practice and made mistakes and lost confidence and actually employed somebody else to come into the practice to place implants and very nearly walked away from it. So I was delighted when a patient forced me to place an implant again. They came back in, I'd done one on them previously. They said, "We're not having somebody else do it, you need to do this." And
Wow.
and the atmosphere that day in the practice was so nervous. It was full of energy, but nervous energy. And I came out and I said, I loved that. I forgot how much I'd loved it. And I said, I'm going to do it properly. So I went back and got my diploma.
That's awesome.
Yeah. And then focused. That's the focus of my career completely. Yeah.
Amazing. So what was then the course you then did that sort of has ignited that again?
Yeah, so I went down to the college, like Royal College in London, and did the diploma there, which I think is an absolutely fantastic theoretical course, it really cemented that knowledge that I needed to be able to treatment plan properly and to tackle these cases. I was very fortunate to be in a position where I was a practice owner, so I was able to get the cases and the practical experience. I was in control of that. I think it would be a bit trickier to do a course like that if you were an associate and didn't have that control.
I'm in awe because I've been graduated 4 years, so I'm like, oh, am I going to suddenly get a practice?
It's amazing. You just went for it at that stage, huh? What inspired you to do it at that stage?
Honestly, so my ex-boyfriend at the time, who was just like, my university boyfriend, but his whole family were entrepreneurs. And I hadn't really thought about it, but when you spend every Sunday lunch with people saying, not are you going to set up a practice, but when is it happening? What does that look like? And they start to spark that inside you. And then a property became available really near where I grew up, and it was an old doctor's surgery. So I was thinking, well, that's quite good from a planning perspective. So I just went for it. I put in a low offer. I never thought I would get it. I was driving up north to Aviemore for the weekend when I got the phone call, and I was like, oh, okay, now I have to do this. And that's the thing, is once you've committed to something, you just need to do everything to make it work. And that's what we found over the years. We expanded a few years ago now. So we went from the initial 3 surgery practice, we're now at 8. So each time it's been just commit to it and then work out the details. And I think that's really important, is that you just make that leap of faith, first of all.
And have the people around you that are using the right words.
Yeah, well, that's it. I mean, I'm so lucky to have the team that I've got. And, lots and lots of our team members have been with us from day one, and I could not do it without them. My sister, bless her, my rock, is my practice manager and has been from day one. We opened together. She actually started working for the practice before it even opened, sort of marketing and getting people booked in. So I don't know if I could do it without that solid team around me. So
what's it like then, the dynamic, if you have family as your practice manager?
Everybody says this. It's never been a negative for me. We've always been so close. We're very open. So if there is something that's annoying either of us, we air it immediately and it doesn't drag on. And just knowing you've got somebody there that you trust implicitly, for me, that's huge. I don't know if I certainly couldn't be doing everything that I'm doing, because I can now spend a lot of time away from the practice to develop, new passions and not worry about it. I know it's in good hands. I know it's running really, really well. And that's just such a joy, because it allows me to then push my dreams.
Amazing. How did you find sort of that taking that business step? Because it's definitely something, obviously, at uni, you're not so prepared for at all.
Yeah, I think the quickest way to learn is to make a ton of mistakes. Make them fast, learn from them fast, and move on and change things. And if I look back at the stuff we did initially, we opened on day one and we'd forgotten to get change for the till. We were still dealing in cash at that point. Just stupid things that you very quickly go right. And then bigger mistakes as we moved on. I heard you talk about your problem with your server. We had a massive problem. Yeah, we had a massive problem with our backup system very early on, lost lots of patient notes. It was very tricky, and you have to put everything in place. But you learn from everything that goes wrong and you grow from it.
So are you at a point now, having done it for this long, that you don't have any problems now? Or do you just look at them differently?
We don't have any major issues. I think we're facing the same problems that I think everyone in dentistry is. Because we're constantly growing and expanding, we are having to add to our team all the time, and that is definitely getting trickier. I find that a lot harder. I'm sure everybody else is seeing it. The number of applicants for the roles are definitely getting less and less, and potentially poorer quality for trainees and things. So it's hard. That side of things is very hard and definitely isn't getting easier. But once you find those team members and once they're in, yes, that side of things is, we've got all the systems in place to make sure that everything works really well. So that's definitely takes care of itself now, thank goodness.
That's awesome. I think, Leanne, I met you when you were I think you had just finished your Royal College exams at the time. Yeah. And you were we were both going to stuff as new in the field and just kind of seeing what's out there and at CPD events and stuff. And you were everywhere. You went to everything, didn't you? I was trying to do the same. And it's scary because you don't know anyone and you're kind of on your own.
Very daunting. But I think that if you're going to do implants, in any way, or if you're even thinking about it, you have to immerse yourself fully. You have to like work out who you want to be like, who you really respect and admire, and then reach out to them, you know, try and be around these people and have them really drive your career forward. And that's what I was doing at that point, was just to try and surround myself with everything I possibly could. And I think we met at a speakers training thing, Ali, where I said, I will never speak, not a chance. There's no way I'm getting it.
Yeah.
And now look at you. Yeah. Yeah. No, it's amazing. Who have been the people that inspired you and that you wanted to emulate?
Oh gosh, I mean, I've been so fortunate. There's been loads and loads of really positive role models within implant dentistry that have really helped me. Ferhan was an amazing mentor for me in my full arch. Martin Monadea has been incredible in supporting me both in implants and then in speaking and stuff. I'm very lucky to have Emer O'Connell round the corner from me, and she has just been such a trailblazer, so to be able to even remotely follow in her footsteps would be incredible. So she's been fantastic, and loads more. I will have forgotten names, they'll not be happy.
No, you're naming the good people, you know, the people who treat it like there's enough to go around and help others up. Yeah.
And that's the way it should be. You know, we shouldn't be competing, or we should be inspiring and lifting each other and making sure that we all achieve the best we possibly can.
Because you've kind of done your Dentsply Peers journey. Can you tell us about that? What is it and what do you do?
Yeah, so I'm a KOL for Dentsply, but last year I was invited to submit a case as part of the Peers contest. So they do a clinical contest every year, and I submitted it. Didn't really think anything of it. You then had to do like a sort of panel, almost like an exam. I think it was harder than my diploma exam to get your case. I know, I was like, wasn't prepared for this. And I won, and I got to go to Vegas and me and my sister got to go to Vegas to DS World, which is this unbelievable conference. You know, it's just on a scale that I couldn't even possibly imagine. So we flew over there. It was fabulous. And this year I'm actually being allowed to be a judge on it. So I get to see who gets to go. Yeah, so I'm really excited about that. I've just had the cases through. They're really impressive. I'm like, wow, you know, some beautiful, beautiful cases, which is great.
That is incredible. So what was it like? Because when did you start working with? Because you went from doing your exams, you're running your practice, and then you kind of very quickly got involved in the wider world of implant dentistry and being a KOL and part of committees and things. So how did that happen?
I mean, I've been very, very lucky that Dentsply have been incredibly supportive. We use them almost exclusively for all our restorative aspects, you know, before we became a bigger referral practice. And they put me on a course basically called First to 50, which was this programme designed to encourage female speakers. They want 50% female speakers. They want to be the first company that does it. Right. And I remember logging in, it was all on Zoom with this American lady, Janice, who has changed my life, like without question. And she was brutal, but in a good way, in a very loving, brutal way. And she taught me that I don't mean anybody can speak, but actually it is. It's a technique, and it's you know, we learn how to place implants or how to do fillings or how to do crown preps, and we can all learn to present and to speak. And that kind of gave me the confidence, and then opportunities started to arise, and I just kept saying yes. You know, even if I was thinking, oh my God, I don't want to do that. That sounds horrendously scary. And I still do this now. I go, nope, just say yes, and then worry about how you're going to manage it or find out the solution to that. And that's, I think, how doors just start opening really quickly. But it has escalated, you're right, it snowballed very quickly for me, which is good.
I love this ethos of the jump now, think later.
Yeah, the parachute only opens once you jump off the cliff. So.
I love that. Yeah, we're seeing a theme with all the really positive, inspiring people that we're speaking to, and this is the theme. It's don't worry about it, just say yes.
Yeah,
it's awesome. It's awesome.
So you've been sort of pushing sort of a lot of that digital dentistry. Has there been sort of something that's been your biggest change to your practice sort of there?
Yeah, I mean, we started our journey into digital maybe about 8 years ago, and it was entirely driven by my desire to do better, because by that point I had the diploma. I knew I had good theoretical knowledge, but I was really struggling to consistently transfer that into my patient's mouth, and I got really frustrated by that. You know, it's disappointing, and I wanted to do better for my patients. And that was the time that we were going through this expansion. We'd bought the other property next door. So I thought, let's just look at the workflows. And I didn't just purchase a scanner and we went all in. We worked with Dentsply because I knew their systems, I trusted them, I knew their workflows worked for other things. So I contacted them. And we just invested in the whole digital workflow with regards to implants, so which was amazing. So our Prime Scan, CBCT, scanners. We went CEREC for our general dentists, and it's grown from there. So we now have a number of different scanners and systems within the practice. It's been absolutely transformative. We expanded to 6 surgeries. I know because of digital we're now at 8. The growth from changing to digital was so huge.
So is that an efficiency thing, or is it a word of mouth thing, or is it
both? It's both. The time that the patients spend in the chair is significantly less, and the costs, once you get over that initial outlay, the costs are significantly less to produce really high quality restorations, in a lot of cases. But also, patients do love it. We're in a digital world, and if your dentist is doing something different and it's more comfortable and it's quicker and it's more convenient, they talk about it. So there's no doubt that a lot of our new patient referrals are just word of mouth. We don't do that much marketing, if I'm truly honest, or external marketing. It's the patients come to us, which is great.
That's awesome. So Leanne, are you just doing implants now?
So just about. So I had 200 or so little plan patients that I felt so guilty about that I've kept them on for the last. And earlier this year, I was like, I'm just actually being really arrogant. My general dentists are more than capable of looking after these lovely patients. So a letter went out a few months ago. I didn't change anybody's appointment. So I think my last checkups are in September. So they're fast approaching. It's been a really emotional 6 months saying goodbye to people I've looked after for like 16 years. It's been tough. But it's 100% the right thing to do. And they're all been so well looked after that I haven't actually done that much restorative dentistry in the last little while. It's all been implants.
So the leap to go down to the last 200, what inspired that? Because that's been a common story. Emer's talked about the same thing, not on the podcast, but as a person, we're going to speak to her very soon. But what inspired that, and how did you get the confidence or the motivation to take that step?
It was gradual. I'm not going to pretend it wasn't. I made the decision to become a plan dentist quite a few years ago now, actually. That must be 8 or 9. I felt that same at that point, I'd invested a lot of time and money in my own development, and I wanted to do better dentistry, and I wasn't able to provide that on the NHS. It's not possible. And so I made the decision, just me within the practice, because the associates at that point were not on board with that. And it went really well. So I continued to see children on the NHS. Adults were then just plan or stayed within the practice. And that's always been the theme, is that they've never had to leave. None of our patients have had to leave the practice. We've always accommodated them. And then it was, actually, I don't have enough time, so my pay-as-you-go private patients got moved on. And then this year it was my plan. So it has been step by step, rather than just an abrupt, that's enough. But it's normally just because I'm time poor and something has to give. That's normally the driving factor.
What does your sort of split then look like in a week, with balancing sort of the ownership and admin and then all the implants and courses?
I love the fact you think it's balanced in the slightest. I do 2.5 clinical days. So I'm in long days, Wednesday, Thursdays or Tuesday morning. And a lot of our teaching is either evenings or our sorry, apologies, that was my dog behind me. Our platinum program runs on a Saturday. So a couple of Saturdays of the month we're teaching there. And then the rest of the time I'm actually mum. And, I do my practice owner, that side of things at home. I don't have masses to do with being practice owner anymore. That's me being totally honest, that I'm very lucky that a lot of that takes care of itself, and it's only the big decisions that I now have to get involved in.
Do you sort of prioritise that sort of the mother side then?
Yeah, absolutely. I'm very aware that I can't give my boys, I'm not a full-time mum. I wouldn't want it to be. That wasn't for me. So I know that they're not getting that side of me. Sorry.
That's all right. But get your dog involved. Don't worry. We're animal people.
Don't know why he's decided to have an absolute mental attack. But yeah, no, I know that they don't get me full-time. So what I try to do is to make sure that the time that they do get is really quality. So I've tried to split my week in the fact that I have mum days, and I do Zoom calls when they're at school and things like that, but I try not to do it in their time. And then it's easier because then when I'm at work, I am just working. So I find it easier to switch between the roles that way, rather than trying to have a morning of dentistry and then go and be mum. I think I would find that quite tough.
Did you have any time when you were sort of full-time and trying to mother as well?
Absolutely. So I obviously had set the practice up, as I say, young, so I had the practice first before family, and I was expecting my first a couple of years later. And so I was still very much working full-time, still very much trying to do all the practice management role of it, there was no doubt. And I did have to go back to work very early. At that point, I was the only person doing some form of orthodontics. I don't even know what it was now because I was terrible at it. And thank goodness we've got our amazing specialist Josh working with us now. But I had cases ongoing. So I was like having to take my baby in his chair, like his car seat, while I would go and treat a patient, and he was in the staff room being looked after by the nurses. So yeah, there's definitely been that time, and I think it's much trickier when they're younger. By far, to balance all that is much harder.
That is truly having them sort of just in the corner there. That's the
Yeah. I mean, you figured it out though. Do you think, looking back, would you have changed the order of anything?
No, because I think, and I see this time and time again with women that I speak to, and I'm very fortunate that a lot of people do reach out and ask for advice about whether that's practice ownership or journeys into implants. And I see time and time again people delaying what they really want, because they're a mum, and they're worried about the effect that, and quite rightly worried about the effect that it was going to have on their kids and on their family. So I think we always find a reason for it not to be the right time. And by doing it on the flip side, it took that reason away. I was never not going to have kids. So like for me, that wasn't an option. So by having the practice first, I had to just make it work again. You just find a way.
So the people that are reaching out to you, what are sort of kind of the common themes of the trouble in terms of decisions that people are having right now in dentistry, in implant dentistry, women in dentistry?
I think there's still so much confusion, particularly in implants, because there isn't a very specific pathway that you have to take to be an implant dentist. I think there's still so many different routes that you can go down and get there. So I think a lot of people find it very, very daunting initially to even know where to begin. I think that's the big thing. And so most of the time people will contact me to say, where do I start? What do I do? And so that's then trying to find a really safe manner of introducing them into implant dentistry, and also trying to make sure that their expectations are good, that they know, because I think I went on my very first year course and thought I was coming out as the all singing, all dancing implant dentist, had no idea there was all these other wonderful skills that I was going to have to develop over the next, and I'm developing them, still 15 years down the line. But I think we need to manage their expectations better. You don't do a year course and then go out and you're suddenly doing implants day in, day out.
Where would you start?
I think, so for me, it's really, really important, or a key factor, I think, is it is a numbers game, to some extent. And I think the more that we place, the more issues that we face, but that then develops us, grows us, so that we then become better. And I think that you really want an initial year that's going to give you a really strong hands-on element. In basics, has to be very basic. It should not be introducing any of the advanced stuff. That's got to come down the line. But I think there should be lots and lots of hands-on placement with good mentors right by your side. And from early on in the year, the way we've developed our programme is that we know now that you can really strongly deliver theoretical content digitally. If I'm spending a day away from my family, I don't want to be standing listening to somebody lecture anymore. If I can learn that online, then I want to be able to do that. So we focus on, they get their theory up front and then they come join us for 10 days in surgery. And it is, from their second day, they're placing implants on patients.
Wow. So are they bringing their patients down, or are you...
It's a mixture of both, yeah. So a lot of them are referring patients, and the patients get discounted treatment, so they're very on board with this, very happy to do that. But we found it really brilliant, because we've been in our practice for 16 years. The practice has been there, and it's a big practice. I have 4 associates and VTs. We know those patients that genuinely can't afford an implant.
Yeah.
And to be able to go back to them and say, actually, we've got a way of giving you this now at this price. Do you want to do it? It's been lovely to be able to, it's almost like a gift to them to be able, because we know they wanted it and it was, a genuine financial issue. So we've got our patients kind of filling the gaps as such, to make sure that everybody gets the same level of clinical experience.
So what happens if someone reaches out who's from further afield and says, Leanne, I've heard about your course, I want to learn from you. Is there a way for that to happen?
Yeah, absolutely. So they can, as I say, they'll be able to do the theory, and actually some people just do the theory to top up what they've done or not done on other courses, which has been really fantastic. I've just, after the summer, I have a lovely, amazing implant dentist from London, Bina, joining me. And so she is going to be working beside me on these days because it's grown quicker than I thought it would. And so I need to bring in other mentors. But what's really nice is she's going to be able to be a mentor down south. So she will work with those, because a year's not enough. You still need so much support when you come out of that. So she's going to start to support the delegates who are from further afield, which is brilliant. And I'm hoping to sort of put other people in different places that are able to do that.
Dan, I was going to ask, what inspired you to start your course?
Speaking to people who had done year courses and still felt underprepared. It's such a common theme that I was hearing time and time again. And so I was getting approached by lots and lots of people asking me to mentor them after a year's course. And then thought, and you don't know what level of knowledge they've got, and it really varied, like hugely varied, depending where they'd got their experience from or their qualification from. And so I guess I just sat there and thought, let's do this properly. Let's think about what we actually really need, and I'm kind of quite practical in my teaching. I think we've got a tendency to try and make implant dentistry sound really incredible, and it is. But sometimes we make it sound so big and scary that people don't want to venture into it.
It makes us feel important, though.
Yeah, it does. It does. And that's why we do it. That's why we do it. We're trying to keep it exclusive and secret.
I still remember sort of on my first week here, and I had no implant really, and the language, and you were like, and this piece and this, and I was like, I was so I had to keep going home every night and being like, what is this?
And that's kind of also part of the problem. We didn't ease you into it. We just kind of brought you in. But I don't know if you know this or remember, Leanne, but when you launched the course, I tagged Flo in one of your first posts, because Flo was saying she wanted to do implants, and I was like, I don't know if the right course. And then as soon as your name came up, I was like, knowing Leanne, this is the right course. It's just hasn't come down south yet. So it's great to know.
Thank you so much. Yes, we can make that happen, Flo. Absolutely. But no, thank you, Ali, because that's...
I'm genuinely, we didn't talk about this before. Leanne's not on here with us saying, oh, do you want to come plug your post? Leanne, your course. Leanne's here because you're one of the inspiring women in dentistry that I know. And I was saying to Flo, we really wanted to do a series on inspiring women who have been positive and made things happen and encourage other people. Mm-hmm. And I don't know many people outside of implant dentistry, but you're on the 5 people I could think of that I was like, this is amazing. And actually, I think one of the most important things when you're teaching is to inspire and encourage, and not to, what I see a lot of is people go on courses and those courses explain how difficult things are and just send the patients to me until you're ready. And I think it's amazing what you're doing. And I've been watching on socials, your delegates placing implants and what they're saying about you. So how many cohorts have come through now? Is it the first one?
No, we are about to start cohort 3. So we've done it as very small groups, but actually going forward, that's going to be... I said at the beginning of the year, if I even get 5 people and I spend the next year with them, I'll be delighted. And we've had, between the Platinum, which is our surgical programme, and the Gold, we've had now about 60 people go through the courses. And I'm like, oh, okay, well, that's a bit bigger than I expected. So it's been amazing. And I've loved it. And being able to meet lots and lots of different dentists, because I think we don't get that opportunity very often. So actually being able to build networks and give people support and friendships that they can move forward with I've loved that part of it. That's been really special to me.
So what do you attribute the success of, because a lot of courses struggle to recruit delegates. Why do you think you guys have had so many more people than you expected?
Gosh, I don't know. Again, it's been word of mouth. I've been very fortunate in that I have amazing delegates on the course right now who are being so vocal about it, and that's so grateful to them for that. So a lot of the inquiries, I think as well, because I have been involved in dentistry for such a long period of time, so some of our delegates are like previous VTs. We've been doing that in the practice for a while, so I think it was just the right time. I think it's been everything just slotted into place in the right moment, and that's been very, very good for us, and I'm very grateful. It's been exciting.
So how do you figure out how to launch a course, Leanne? You thought, okay, this is something missing and I think I can help with it. Did you just figure everything out?
Yeah, it was a case of just sitting down and really looking at the pain points that I felt people were coming to me with, or that I had personally experienced. A lot of it was based on where I think I would have saved a lot of time, money, heartache had I gone through different training pathway initially. So it was trying to put together something that sort of tackled all them, and speaking to other people who had done it. So, I had great support from people like Fervent who had, been in education before, just to get their do's and don'ts and what they thought would be a good way to approach it. And then I just went for it, writing the theory takes a long time. You know this, Sally. Putting all that together, it's a lot of hard work, but it's good. It's good, and it's trying to tailor it at that right level.
That's the hardest part, because you forget, even though your journey has been so quick, it's so long ago that you did your first implant. So has it helped you reflect on your journey doing this?
100%. And what I have loved, because I think there's like the horrible phrase that people who can't do teach or something like that, which is just terrible. Absolutely.
That's reserved for dental schools.
What's that about? But actually what it's made me do is that every time I'm delivering content, I'm actually going back to find the research, to find out what the current evidence is. And so it's really pushed me and my skills. And when you're being watched all the time, you're like, actually, I really need to up my game here. This needs to be the best I can possibly produce at all times. So that's been good for me. My growth and development in the 12 months has been huge because of the course. And that's exciting.
That's amazing. So you've touched on clinical mentorship. I wanted to ask you about, like, on social media, I see it all the time, you get together with your business group, Farhan's there, Pav is there. And I wanted to ask you about that because please tell us the name of it and what it is. But I've seen this, and I've seen a lot of you go through there and change things and grow in many senses. And I really wanted to ask you about that because I haven't spoken to you since I've seen that.
No, absolutely. So it's a program called Brilliant Beyond Belief. It's by Mahmood Boji, and I had reached out to Farhan, so it was very similar that I had seen Farhan go through this journey, and I thought, wow. And I was feeling, if we go back sort of 18 months ago, I'd actually lost my drive a bit. I'd kind of, I think everything had got easy, and I'd hit the top of that S-curve where I was just like, oh, okay, well, I've achieved it now. I'm here, but I'm actually a little bit bored. And I felt that I could turn up to work and just place implants and everything else was taken care of, and I didn't feel I had any challenges. And so I spoke to Farhan. He said, oh, come down on this day, come down on this course and see what it's about. It's been incredible. It just, they work really hard to find out what you need to re-spark you. I think is probably the best way to, I don't want to give too much away because it's, and he'll thank me for this, because a lot of it you actually want to enter into it almost not knowing, but it's been fantastic. And it's very much about your mindset, and that is something that I now try to carry on and give to my delegates and share that gift as well. Because if you look at the number of dentists going through implant courses versus the number that go on to place implants, there's a huge discrepancy. And I don't think it's anything to do with the implants or the course. I actually do think it's the mindset that they come back into practice with, whether they then continue to try and grow and push. So I try to do quite a bit of that to them. They didn't sign up for that, but that's it's part of the course now.
That's awesome. Do you think that was part of the reason you realized you want to be in education as well?
Yeah, definitely. I think to see the effect that one person can potentially have on a group of people, and people who, when you put them in a room together, look very successful already, to see that they can push them even further and realise that you could potentially make that difference to other people it's a brilliant thing to do. I am loving doing it, but I'm also very grateful that somebody has pushed me to be able to do it as well.
Do you see an imbalance of sort of men and women sort of coming through, sort of there's more male implantologists coming through?
This is a controversial question, isn't it?
You've been getting all the softballs till now, Leanne.
I know. I knew this was coming. I mean, of course, there are more male implant dentists. You know, if you look at statistics, yes, there are more, and there's definitely more male implant speakers and educators currently, at the moment. I can't comment on everybody else's experience. I'd be wrong to do so. Personally, I have never, at any point in my career, found being a female to be a disadvantage, like in any way, shape, or form, whether that's as a dentist, an implant dentist, or a practice owner, or now an educator. But I do definitely see that there is a discrepancy, which I think is changing. I think we're seeing a shift and there are more females definitely coming forward. There are some incredibly talented female dentists or female implant dentists across the UK, and we just don't hear about them as much, which is a shame because, you know, they're without question, they are as good. And a lot of them choose not to put themselves out there. I think that's, you know, that's for whatever reason that's right for them. But they are there. And I think they get forgotten about a lot, and we should be sort of championing them.
So do you think there's anything we can do? Like, I mean, we're specifically now talking about an implant society, essentially, not one of the societies, but us all as people. You mentor implant dentists, probably, I'm guessing this is a massive assumption, but you're mentoring males and females, but especially the females, you're a role model for them. What can we do to break down barriers to encourage more female implant dentists to come into implantology, but also to then be in forums where their voices are heard, be part of societies and speaker engagements and all that kind of thing?
I think to tackle them more females coming into implant dentistry, I think a major issue with that is actually the age hurdle that we're still facing, that we expect new graduates to wait 5-6 years or whatever until they venture into that field. And I have had lots of female VTs who have expressed an interest to do implants. They've then held back thinking that they're too young. And actually what then happens is quite often they will go on to have a family, and it does become more difficult. You know, there's no taking away from that travelling, if you've got young children, to go and do a course, especially if it's not local, the logistics become more tricky. So I think that if we could actually embrace them to come in younger, then it'll almost take away that element, because I do think that's a problem with it. And then it's, how do we do that safely?
So I was just going to play devil's advocate and say, because one of the issues is that implant dentistry is not just implants and the sticking the implant in, right? And actually probably most of the problems we see is if it's not a more holistic understanding. So do you think there's a way that they can do their implant course and then build on the other knowledge rather than the other way around?
I do. I genuinely do. And I think I'll probably be better placed to answer this in a couple of years' time. But what I'm seeing right now is we have some very young delegates currently on the programme, and we have very experienced or very seasoned GDPs. And when the people who've been in practice for maybe 15 years come, they're quite often sort of admitting that they don't know how to raise a flap. They don't know how to suture that confidently. And I understand that, because when I was a general dentist, I wasn't doing that on a day-to-day basis at all. And it's now trying to work out for me, is it easier to actually teach somebody who's still very much in a fresh frame of mind coming from uni, or trying to teach somebody who has these limiting beliefs and these mental blocks already built up into their heads. So it'll be interesting to see how it develops. And maybe I'm wrong, maybe they do need 4 or 5 years. I don't think they do right now. I think if they're given good support and they understand the limitations of what they can do when they leave that course and how much further education they're going to need before they can be an implant dentist.
So then what stage are you saying to your delegates that you can get them to? What is their end point on your course?
We, at the end of the 12 months, when they do the 12-month practicals, they will be confidently placing basic implants. So they're under no illusions. This does not cover, sinus lifts or complex cases, or that it shouldn't. You can't learn that in that period of time. But yes, they can go out and do it.
Sorry, how do you make it then financially viable for beginner implant dentists then? Because essentially then what they need is a pretty high level of mentoring after they finish, and often a lot of the young dentists I've spoken to who want to get into implants, cost is a barrier because they're kind of seeing a general list, and then they want to spend on this course, but then mentoring is going to cost. So what kind of advice do you give them if that's the problem they come to you with?
So I think this is really where the mindset thing and preparing them for that side of things becomes absolutely crucial. So we've already discussed how many implants they're going to be placing the first year. You know, we've discussed the fact that they will have those patients lined up with mentor, lined up the month, they should have it the week after, because the moment you go out and go back into your routine of general practice and you haven't implemented that before you leave the course, then it's going to fall apart. So we work with them to have that ongoing plan and mentorship in place and set up and booked in, so that they never stop. They don't take their foot off the gas. It should go seamlessly from the course straight into being able to do it in practice. And most of them, the average that they'll place in the course is anywhere between, the average is about 8. Some of them are placing 10 over the year, so they've got a good start in numbers wise, and then obviously we try to encourage mentorship in some description for the first 20, and then any complicated case after that.
Brilliant.
This is sort of another bit of a loaded question, but have you ever felt sort of imposter syndrome? I mean, we were looking up some stats before, and like the fact that you're even a practice owner, sort of only 11% of practice owners are women. So have you ever felt that sort of in their space? Or
I'm laughing because I feel it all the time, and I can't believe there's people that don't, if I'm truly honest. But something I've worked really hard on is trying to not see it as a negative thing, because if I've got that feeling, if I'm feeling uncomfortable, it's because I'm pushing my boundaries and I'm growing. And we all know nobody grows if you stay in your comfort zone. You've got to push outside that to develop. So every time I do start to feel it, I'm like, right, okay, try and tell myself that that's actually a really good thing that I'm feeling, and it means that something exciting is happening. But yeah, I mean, I felt it coming on here. So yeah.
Everyone keeps saying this, but there's like 10 people who listen to this, so don't worry about it.
Perfect.
Yeah, because Leanne, one of the things, like when we were speaking, it was you were going to one of your first speaking engagements, I think, and you were like, I don't really know why they've kind of let me do this, and I'm actually really nervous. When you're gonna speak now, do you still get really nervous?
Yeah, 100%. And it's funny, it's not so much like the ones that we do in the practice and the groups, I know them, and that's very different. But I was speaking at the BSRD just 2-3 weeks ago, and I still got nervous. My stomach still turned butterflies, definitely. And it's happened right up until I take a foot onto the stage. And then for whatever reason, something kicks in and I'm able to do it. But an hour before that, you would look at me and think, no, there's no way she's getting up there. So, and I just sit there. I'm very quiet. You'll know if I'm nervous. I don't speak. So.
What would you say to yourself if you could go back and you could give yourself one piece of advice, right at the beginning of your journey? Because you have to, now you only get one piece of advice, and you're going to have to pick whether you're speaking to yourself as a person, a practice owner, a clinician. Is there one piece of advice that you think would have saved you a lot of trouble over your career?
I don't know if I would change anything, because if you look back, it's all the ups and downs that actually bring you to where you are, and you would be in a very different place. So, but I think I would go back and just reassure myself to go with my gut instinct, because that's how that's one of my major rules, and I would just say, yeah, that is the right thing to do. Just keep doing it. So, it'd be positive advice.
It's been a really, really inspiring chat. I've just got a couple of dental quickfire questions.
Okay.
So, what is your favourite procedure to do?
Oh, a single implant in the aesthetic zone. My stress levels are through the roof while I'm going through the whole process. But if you get it right and you see the patient's face at the end, and that I love that.
Oh, Leanne, you're in the nicest possible way. You are a lunatic. That stress.
I love it.
That's amazing. That's amazing.
Yeah.
No, I totally get it.
What is your favourite scrub colour to wear?
Oh, well, yeah. So recently I purchased a lovely pair of purple scrubs, which I really liked, and it sparked a little debate amongst my team whether I looked like a grape or an aubergine. So they have been shelved. They won't. They're not getting worn again. So we wear grey. We wear grey. So and we always have done. So I haven't really. I was just being experimental with my purple ones, but I've been informed that they're not coming back. So.
With no context, what is your favourite tooth?
Upper left one, because my own little upper left one has no root. So every morning when I wake up and it's still in my mouth, I think, oh, good, excellent.
Well, now this is going to be, I think this is going to be the biggest compliment. Whoever you let put that implant in,
Could you do
you're
it
gonna
yourself?
she's gonna have a denture. What? She's gonna go, no, it's not worth it.
Genuinely, I've spoken to so many of my friends who are amazing implant dentists. They all say this. They're like, when it goes, I'm like, no, it's not going to go. But I mean, I have to be realistic. They're like, when it goes, what are you going to do? No, don't. I haven't decided yet. There's so many fabulous ones. And I kind of hope that when it does fall out, like all the people I know are retired. So I'll have to be somebody I've taught.
Go to a stranger.
Be someone that's been on my course. That's who I'll trust.
If you were leaving school right sort of now, what would you want to do?
Exactly the same. I'm so lucky, and I know it, that I love every single part of what I do. As a dentist, as an educator, as a practice owner, I love it. I get up every day so excited, to be able to go into work and to be able to do what I'm doing. So I wouldn't change a thing. Not a thing.
Amazing.
Leanne, can I just say, you are such an inspiration. I'm not just saying that. I really, I haven't seen you often, but I met you a few times in a short period of time. And I think one of the most amazing things was that you were very open and transparent about how you were feeling, the nerves, I don't really know what's going on here, in a world where everyone was kind of pretending they had all of the answers. And it's just, I'm so glad to be in a world where people like you are the ones that succeed. So thank you for coming and sharing things, and thank you for doing what you do.
Oh, thank you so much. Thank you.
Thank you so much, and I will be signing up for your course.
Fabulous. Can't wait.
Has Leanne earned her dental pearl?
Yes, she's
Or
earned
have
her
we-
dental
have we
pearl.
been the
Well,
feature?
you told me off last episode, so
It's just a...
I'm intrigued what my pearl is.
Yeah, so was I, and I thought it was a really weird phrase because no one was winning anything at the end of the quiz. But actually, now I've grown fond of the phrase.
okay.
So
Well, you have definitely earned your virtual dental pearl.
Thank you very much. Thank you.
yeah,
Thank you,
That's all. Thanks so much, guys.
Ali. Why did you invest in the Navident dynamic navigation system?
it's incredible. It brings our safety and accuracy up for patients. Here's a tracker that we use, and thanks to Rob from the Dental Imaging Company, it's been great support and so easy to set up. I see why so many people go to him for their digital imaging, 3D or 2-dimensional, and also all their surgical supplies like Ustamed screws. Rob's been incredible, and I'd highly recommend working with him.
Ali, can you name everything in the practice that's made by W&H?
Ooh, off the top of my head, all of our handpieces, our sterilization equipment, my implant motor, the PiezoMed, they're an incredible company to work with because they're an Austrian company that focus on hygiene, and we know from studies that patients care most about hygiene. To top it all off, the support we get from them is amazing. They don't actually supply the equipment, but they provide the support. Now that's true support. Crown Dental burrs have a rota system, and what that means is I have the same burr box every time with the same burrs numbered. I ask my nurse for the number of burr rather than having to remember the name of it. And it also means that when I need a new burr, we go to the box which has this card, and if we are running out, my nurse can just scan the QR code and order the same one. So we never have problems with inconsistencies with burr boxes or burrs. Thank you very much for implementing this for me, Paul. I love it. And the other thing I love is that Paul's a problem solver. So I worked with him to curate this alveoplasty set, which he has such great knowledge for all of his burrs. And it means that we have everything we need for full arch surgery. So whether you have a problem with your set and need this set, or you have a problem that you need help solving, Crown Dental Burrs will help you do it.